Hello everyone, a very good afternoon to all of you. Today we are going to diagnose endo-PERIO lesion. See, I have added a few case scenario examples as well. Okay, so before moving into the actual cases, we'll be talking about a few parameters and I'll tell you how these parameters work out in each kind of situations or lesions. Okay, so first one is visual examination. As the name implies, I'm seeing the patient, I'm not touching, I'm not palpating, or I'm not taking any kind of x-rays. Okay, I'm just seeing the patient. So while seeing the patient, in case of a primary perio, definitely I can see block, calculus, recession. Okay, in case of primary endo, I'll predominantly see any kind of respiratory procedures, caries, RCT, especially poorly treated root canal treatment, crowns. Okay, so or any kind of erosions. So these things I'll see in primary endodontic lesions. Okay, if you take primary endo with secondary perio, these features will be more evidently seen in primary endo with secondary perio, and these features will be seen predominantly in primary perio with secondary endo. Okay, so when I look at a patient, 50% of the times I'll come to a conclusion whether it will go for primary endo secondary perio or it is a pure primary endo or pure primary perio. Okay, so take a look at this case. Patient has a discolored tooth, and 80% of the times I'll tell this patient is primary endodontic patient. Obviously the tooth will be non-vital, the tooth has got necrotic pulp, and I cannot find out any kind of abscess in the attached gingiva or marginal gingiva. So this case, straightforward, it's primary endo, root canal treatment followed by cap. Okay, the next parameter is palpation. Okay, see, palpation, it's of no significance or very less significance. It is just a clinical sign to find out whether the patient is having pain. You cannot decide on palpating whether it is a primary endo or secondary perio. It is just to evaluate whether the patient is having pain. So it is a very minor parameter, and obviously you will have pain in all four situations. Okay, you will have pain in all four situations. Next is a very important parameter which I always stress upon: vitality. Okay, except in primary perio, pure primary perio, the tooth will be vital, and apart from this, the rest of all, the tooth will be non-vital. Be it primary perio with secondary endo, or primary endo with secondary perio, or primary endo. So apart from pure primary perio, the rest of all the situations, the tooth will be non-vital. Okay, next very important parameter is GB tracing. Okay, so if I insert a cataparca into the gingival sulcus or a sinus tract, okay, see, sinus tract is different from periodontal abscess. Sinus tract is where the abscess is started opening. It's a chronic infection, whereas abscess, periodontal abscess, is an acute infection. Okay, so when I insert a GP into the sinus tract or into the sulcus, if the GP moves towards the lateral surface of the tooth, okay, if it moves along the lateral surface of the root, then that is primary perio. If the cataparca points towards the furcation or root apex, it is primary endo. So say for example, a case of primary endo with secondary perio comes. When I do a cataparca tracing, my GP should go towards furcation or root apex. If it is primary perio with secondary endo, my GP should point towards the lateral surface of the root. Okay, so GP tracing is another very important parameter. If it towards the furcation or the root apex, primary endodontic lesion, it can be associated with secondaries, but it is primary endo. If my GP tracing is towards the lateral surface of the root, then it will be primary perio. Again, it can be associated with secondary endo. Okay, so the next important parameter is pocket. Okay, so except in primary endo, the rest of all the situations you will have pocket. Okay, so except in primary endo, that is if the patient is having only endodontic lesion or only caries involving the pulp, irreversible pulpitis with no kind of interdental bone loss, that will go for primary endo. Apart from that situation, in all the situations you will have pocket formation. The next situation is pain. Okay, we all know endodontic pain will be sharp shooting pain. The patient sometimes awakes from sleep, but a perio pain will be a dull gnawing pain. The patient might not be experiencing that kind of a severe pain as compared to the pulpitis, irreversible pulpitis. Okay, so in perio there will be dull gnawing pain, whereas in endo it will be sharp shooting type of pain. Okay, now mobility. See, mobility can be seen in all the four situations. Okay, you can see mobility even in primary endodontic lesions, but it will be isolated mobility, and after I do a root canal treatment, the mobility will subside. Okay, so primary perio, again there can be mobility in primary endo with secondary perio also there can be mobility, but the distinguishing feature between primary endo with secondary perio and primary perio with secondary endo in case of mobility is, in case of primary perio, there will be generalized mobility. Okay, all the tooth will be have generalized mobility, or all the tooth will have generalized bone loss, and also there will be additive factor like non-vital tooth or GP tracing towards the furcation, or there be caries. So you come to a diagnosis of secondary endo. Okay, so primary perio with secondary endo will have generalized bone loss, and primary endo with secondary perio can be associated with isolated bone loss. Okay, now let us diagnose a few cases based on these parameters. Now you are going to tell me the diagnosis based on the above parameters we have discussed. Okay, so this patient, catabarca tracing is towards the lateral surface of the root, vitality is non-vital, and there is a generalized pocket formation. So what will be the diagnosis? Beautiful. This is a case of primary perio with secondary endo. How do you manage these patients? A patient came, you have diagnosed the case as primary perio with secondary endo, and how you go about the treatment. So a case of primary perio with secondary endo or primary endo with secondary perio, the first treatment will be phase 1. That is, I'll do scaling, I'll do root planing, and after that, root canal treatment should be initiated in all the cases. Okay, see, whether it is a primary perio or primary endo, root canal treatment should be followed after phase 1, and then only I should evaluate and proceed to periodontal flap surgeries. Okay, so except in pure primary perio, rest of all the three situations I'll go for phase 1 root canal treatment, and then evaluation, if needed, periodontal surgeries. That is how the treatment plan will go. Phase 1, which is nothing but scaling and root planing, which is followed by RCT, which is followed by evaluation phase, and if needed, I'll go for periodontal surgeries. In primary perio, I don't need root canal treatment, right? Because there is only plaque calculus recession. So I'll straight away go with phase 1, evaluate phase 2 if needed. Okay, so this case we have diagnosed it as primary perio with secondary endo. Okay, so what I'll do, I'll do scaling, I'll do root planing, send the patient to endo, do a root canal treatment, and then I'll call the patient after 2 to 3 months. I will evaluate the patient. So this is a very important phase. Okay, so after 2 to 3 months, I'll call the patient and evaluate, and I'll check for mobility. If the mobility is greater than grade 1, I'll do splinting. Again, I will evaluate. If the periapical lesion does not resolve even after 2 to 3 months, and there is grade 2 to grade 3 mobility, then that'll go for O+ prognosis. I'll extract the tooth. If the periapical lesion is gone, then I will evaluate whether the tooth is mobile. If the tooth is not mobile, I'll go for flap surgeries. I'll go for regenerative procedures like bone grafts and GTR if it can be done. Okay, this case I'll do scaling, root planing, root canal treatment, evaluate, and definitely this case needs any kind of periodontal surgical involvement, be it a simple open flap debridement or any kind of bone grafts if at all it can be placed. Okay. So the next case, this patient, I can see a vital preparation done and a cap placed over the crown, right? So because of which I can see some kind of an angular bone loss on the distal aspect of the tooth, might be because of foot impaction. Okay, so I can see some kind of periapical lesion, furcation involvement. Okay, so when I track the GP, it moves towards the apex of the tooth. The tooth will be non-vital. Obviously, there is periapical lesion. The tooth will be non-vital. Pocket is present because of bone loss, and I can see some crown placed, vital preparation. Okay, see, the problem with vital preparation and placing a crown is sometimes there can be leakage from the crown. Okay, if at all there is a leakage from the crown, it will directly go and impact the dentine. So what happens, there will be easily the tooth might get affected. There will be formation of periapical lesion and pain. Okay, this is a straightforward case of primary endo with secondary perio. What is the treatment plan? Simple: scaling, root planing, root canal treatment, evaluate for 2 to 3 months, and if the lesion subsides and if there is no pocket depth, then I'll just put the patient under maintenance. And if the patient is having pocket, then I'll proceed to any kind of periodontal management. Okay, next case. So look at this patient. Root canal treatment was done few years back. This patient came, root canal treatment was done few years back. I can see angular bone loss. Okay, so my first thought will be foot impaction. Okay, and there is no periapical lesion. This is a case of pure primary periodontic lesion. Okay, so this, the reason might be because of foot impaction. So what I'll do, I'll just do phase 1, evaluate, raise the flap, keep bone grafts, and suture it off. So this is a case of primary periodontal lesion. So I hope this video makes sense and you can grasp at least I can able to resolve at least 10% of your queries regarding endo-perio lesion. Okay, so thank you so much for watching the video. Have a nice day.